Hello all, welcome. Thank you for joining us on the New Indian Express. I am Anusha Ravi Sood and with me is my colleague Ranjani Madhavan, and today we are here to discuss about COVID-19, otherwise known as coronavirus, which has taken center stage in the international, national as well as the state level. Karnataka recorded India's first coronavirus related death, a 76-year-old from Kalburgi. This topic today was raised in the Karnataka Assembly, the opposition targeting the government on its lack of preparedness. Within a matter of 1 hour of debate, the government has stepped up measures, taken a lot of precautionary measures. Schools and colleges have been shut down. Offices, especially software companies, have been asked to ask their employees to work from home. Several measures have been taken in place. The government trying its best not just to contain the epidemic but also appealing to the people not to panic over the scenario. As of now, let me go across to my colleague Ranjani Madhavan. She has the details of what the measures the government has taken so far in Karnataka, led by Chief Minister B.S. Yediyurappa and Health and Family Welfare Minister Sri Ramlu. But before we get to that, let us understand a little brief of what we know about the cases in Karnataka so far. So Ranjani, one death one death in India being recorded in Karnataka. What do we know about that particular case? Have there been complications? Have necessary measures been taken? And what about the other cases that we know of so far?
So the death that happened in Kalburgi happened on March 10th, and the family of the person who died said that there was a case of medical negligence. They said that the private hospital refused to treat them, which is why they had to take the patient from Kalburgi to Hyderabad, and the hospital in Hyderabad also refused to treat them, so had to come back to Kalburgi, which is when he died on the way. But the government, on the other hand, is saying that the family did not listen to the doctors and against medical advice shifted the patient. This is the situation right now with this patient, and apart from him, there are 5 other cases in Bangalore. They are currently being treated at Rajiv Gandhi Institute of Chest Diseases and also Jayanagar General Hospital. They are doing fine. They're stable right now and they're quarantined, and their primary and secondary contacts are also being home quarantined. And apart from them, there are totally 906 people who are being quarantined. And in the Karnataka International Airport and Mangalore Airport, there are around 60,000 plus people who are being screened. And even at the seaports, people are being screened. There is also a 104 helpline started by the government. This is for people who have any questions. They can call them, and if they themselves have any symptoms of cold, cough or fever, they can also call up the helpline and seek help.
Well, as like Ranjani was pointing out, she spoke about screening that is taking place not just at the airports but also at ports. The very question was also raised in the assembly today, with the opposition asking the government. It has almost been a week since coronavirus has taken the center stage, at least in news platforms. It has been in mainstream news for the last 1 week. Why have screening centers not been set up in other airports in the state as well? Not just thermal screening set up, but also testing facilities, laboratory facilities. As of now, there are very few laboratory facilities where samples are being sent to verify or confirm coronavirus in suspected cases. Today, the state government has anyway stated that it will set up such laboratories in every district. About 10 beds in government hospitals across the state in every district and taluk level will be set aside for patients suspected of suffering from coronavirus. In Bangalore, private hospitals have been roped in to set aside a set number of beds for cases that come in under suspected coronavirus. Now, what are the other measures that the state government is taking? As of now, we understand today the Chief Minister came up with a set of measures, not just to tackle the problem of suspected cases, but also to contain spread of the coronavirus. What are the measures like?
So the first thing is, anybody who comes from the COVID affected countries, right now they have to be quarantined for 14 days at home, and the government is also planning to convert an existing government hospital into a facility specially to tackle coronavirus only. And they've also started a 9-member committee to raise awareness on coronavirus itself among the public. And there is also an issue of the prices of masks and sanitizers being hiked in shops, and the government is conducting checks in pharmacies and taking action against those who are hiking the prices.
Well, the government has also appealed that at least for the next 1 week, all places where there is public gathering, be it marriage ceremonies, be it congregations, conferences, to be put away. Examinations only for 10th standard, that's the board examinations, will go on as per schedule, but colleges have been given a leeway to defer their examinations. Classes 1 to 6, there will be no examination starting today. Children will be ranked or rated depending on the exams that they had taken till today. Classes between 7 and 9, students have been given compulsory leave, and examinations need to be completed within 23rd of March. Class 10 students, like we said, scheduled exams are already underway. There will be no impact on examinations that have already been scheduled, but all classes, whether it's diploma, whether it is engineering colleges, whether all kinds of colleges, private, aided and government, will remain shut. The government has appealed to people to stay away from places like malls, cinema halls, places like swimming pools, parks. In fact, in Bengaluru, in a lot of localities like BTM, parks are already being closed. The appeal from the government to the people is stay safe. There is no need to panic, but social distancing is key right now. We all have been hearing about the measures that WHO has recommended. Take precautions to have a sanitized, hygienized environment around you, washing of hands, staying away from people, trying not to touch, not to be in physical contact with a lot of people is going to help at this hour. We at the New Indian Express have been striving to get you the latest updates at the earliest. We will continue to do so. Coronavirus will be right on top of our priority list to bring to our viewers. Do stay tuned. We are on YouTube, we are on Twitter, we are on Facebook. We Express handles for across the country with multiple states are already up on Twitter. Do follow us for the latest updates. Thank you so much. With the camera is Nagraj Gadikar.